Dr. Afsoon Gazvinian here, Doctor of Pharmacy and Certified Functional Medicine Practitioner. I hope wherever you are, you're keeping safe and you're keeping healthy. Today's session is part 3 of Type 2 Diabetes series. In part 1 and 2 of the series, we looked at the root cause of Type 2 diabetes. Why is it that our blood sugar goes up? What happens? What does our body do with that extra amount of sugar? And where is it being stored? We also looked at the kind of food that cause high rise of blood sugar and crash of blood sugar that over time lead to Type 2 diabetes. In this session, I will talk about the progression of this disease, and I will go over some of the common medications that we use to treat Type 2 diabetes. And by the end of the presentation, my hope is that you will see why is it so critical that we take charge of our health ourselves and make the necessary changes every day if we don't want to end up with Type 2 diabetes and deal with its debilitating consequences for life. And in the next sessions, I will talk about the best practices and the best nutritional plans and lifestyle changes that can help us get back into health. To be part of REIVAS' journey to healing, give this page a thumbs up, subscribe to the channel, and hit the notification bell so that you will be informed once the new information is released. Type 2 diabetes is a chronic disease or is a long-term disease, and once it is diagnosed and once the medications are started, it is traditionally thought and considered to be non-reversible and for life. Insulin resistance is also called pre-diabetes or pre-type 2 diabetes. And as you can see on the red arrow, Type 2 diabetes develop in progression over years and decades. Let's take a look at the left side of this diagram. Genetics do play a role in developing Type 2 diabetes. However, it has been shown that environment has a greater effect than our genes. And if people in the same family have Type 2 diabetes, it's more often because they eat the same food and follow the same lifestyle. And poor nutrition, not enough physical activity, obesity, especially around the midsection, lipid profile imbalances, and high blood pressure are some of the risk factors that can push us over the edge from normal to to Type 2 diabetes. And you can see at the bottom of the diagram in red the two primary markers that we use to track blood sugar are fasting blood sugar, which is taken after a fasting overnight, and hemoglobin A1C, which shows our average level of blood sugar over the past 2 to 3 months. And in the bottom left, you can see the numbers that current lab values consider as normal, which is under 99 milligrams per deciliter for fasting blood sugar and under 5.7 for A1C. And when we take a fasting test and our levels are from 100 to 125 milligrams per deciliter, it is considered pre-diabetes. And once we cross the 126 mark, we are now considered a patient with Type 2 diabetes. And it does not take long to see the fast progression of disease from there, because this is the point that we have already broken the sugar metabolizing system in our body. And the high levels of blood sugar start damaging our internal organs, causing severe disabilities such as blindness, kidney failure leading to dialysis, and also leg amputation. And it contributes to many other severe and degenerative conditions such as cardiovascular disease, stroke, and Alzheimer's disease. In fact, Alzheimer's disease is now known as Type 3 diabetes because too much sugar damages our brain cells. So as you can see, type 2 diabetes is a continuum. And all of us are somewhere along this line, and we go from healthy into disease, and we may be slipping towards the disease every day. And there is no such thing as a line. There is no line that if we cross now, we are diseased. Or we think that we are okay and we are healthy until we cross the 99 milligrams per deciliter fasting blood sugar, and now we have pre-diabetes. And in fact, we don't even want to be at that 99 border of disease. We want to be way lower so that we know that we're far away from the disease borderline, fasting blood sugar. And the optimum range of fasting blood glucose is somewhere in mid-70 to mid-80 milligrams per deciliter and A1C of less than 5.3. Studies show that people with fasting blood glucose levels above 95 had more than 3 times the risk of developing future diabetes than people with fasting blood glucose of below 90. And the recent data shows progressively increasing risk of heart disease in men with fasting blood glucose levels above 85 milligrams per deciliter, as compared to those with fasting blood glucose of 81 or lower. And this is a call for awareness and for action. Know your numbers, know your fasting blood sugar, your A1C number, and if you can, get a monitor for blood sugar and home monitor your blood sugar levels when you eat, before you eat, after food, and find out where you are in the continuum and how strictly you need to act in order to get yourself back into the optimum levels. In our current conventional medicine model, once people are diagnosed with pre-diabetes, the majority of the times it is automatically assumed that they cannot successfully reduce their blood sugar using diet and lifestyle changes, and they are prescribed with medications at the pre-diabetes stage. And one of the medications that is very commonly used for patients with pre-diabetes is metformin, and it increases the sensitivity of the cells so that they would open up their channels and forcefully bring more sugar inside of them. And if you recall, these are the cells of the body that they did not have the ability to handle any more sugar. They were already had enough storage. And very often at this stage, patients, they continue the same lifestyle that they had before, the same food, the same stress that they had, and inactivity in life, and all of these things, they won't change because they see that their numbers look normal just because they are on medication. And this also can be another contributor into getting further into the type 2 diabetes continuum. And our patients keep coming back with higher blood sugar levels, and we keep adding more medications to their drug regimen from different classes of medicines. And for the most part, these medications have the same end point in mind: to take the sugar out of the blood and put it either inside of the cells or excrete it out of the body. Let's take a look at how current medications reduce blood sugar. And we need to realize that they are symptom treatment to reduce blood sugar levels, and they are not a cure for type 2 diabetes. Number 1, by increasing the sensitivity of cells to insulin, to force the cells in accepting more sugar, and with this we are promoting more storage of sugar and fat in the cells. Number 2, by forcing pancreas, which is an organ that secretes insulin, to produce more insulin to push sugar inside of the cells. Again, we are cramming the cells with more sugar and causing more overflow of sugar and fat, and also fat storage. Number 3, by forcing excretion of extra sugar through the kidneys into urine to decrease blood sugar levels this way. And we are only relieving high blood sugar temporarily. Number 4, by stopping liver from releasing stored glucose to keep blood sugar down. But then again, we are not helping the liver emptying up the extra sugar storage. Number 5, by delaying the absorption of sugar from the food, from the intestinal tract. And still, we haven't solved anything, and blood sugar will go up later once the food is absorbed. And number 6, after all of these fail, injecting external insulin to patient to push extra sugar inside of the cells, which leads to more storage, more weight gain, and disease progression down the line. And these medications come with a very severe side effects, especially if different groups of medications added together. But if you are on medications right now, I do not recommend that you stop taking your medications, because high blood sugar can be very harmful for your body, as we talked about. I do, however, suggest that you start looking into diet and lifestyle changes and talk to your doctor, talk to a functional medicine practitioner, and learn how to step by step change your lifestyle in a way that your body starts getting back into insulin sensitivity, and you can taper down your medication over time. And I think that our patients have the right to know that how does the medications that they're putting in their body works? What is the progression of their disease? How are things being handled? And then they have an informative choice to make, whether they want to take a medication or they really want to take charge and make some changes. And this disease, being a lifestyle disease, is something that we need to work on day after day after day. This is not a disease that is like a headache or a broken leg or an infection that we can take a pain reliever or antibiotic for a couple of days or a few days and we get better. We're talking about a lifetime of medication and lifetime of inconvenience and worry and cost. And I think it's a good idea to start looking into all different aspects of it and start making a wise decision. In the next session, I will discuss the food guidelines from USDA and from American Diabetes Association, and I will discuss why these guidelines are not up to date and they are not optimum for our patients. And no wonder this disease is getting all over the world and our patients are having such a hard time getting this disease under control. I will also discuss the best practices and the best food nutrition guidelines in order to have a steady level of blood sugar and in order for our body to start using up those storage fats and sugar and help our body get back to normal. I hope this information helped, and thank you so much for tuning in. If you like this information and you find it useful, please share them with your family and friends and loved ones, and I can't wait to see you in the next session. Until then, stay well.